And I'm back. Aloha, everybody. Again, it is Dr. Albert Lin, the traveling doctor, back for more. And yes, I will be shaving or cutting my head and buzzing my hair later today. I know everybody's looking a little shaggy. I can't believe I started on time today, slightly on time. It's 1:02 p.m. So happy belated Easter to everybody out there, and aloha. I kind of want to do something a little bit different today, and kind of talk a little bit backwards about this, or sort of do the world news and then do the U.S. news and the Hawaii news and all that. So first of all, hey, what's up, Marissa? Coming in on Facebook. Again, I'm on Instagram and Live and Facebook Live, and I'll have these on YouTube. Welcome to John from New York. Thanks for coming in. John's been very helpful with a lot of the news on the ground from New York. And hey to Lisa over from LA right now. I got a lot of updates over the weekend from my friends in New York City who are working in the ICUs, the actual doctors, okay? So as you know, I'm a Hawaii doctor. Hawaii, as you all know, has not been getting hit very, very hard. But I'll talk about that a little bit later. My friend's been working really hard in New York. So it really kind of annoys me when people are like, this is a big scam and no one's really sick and we shouldn't be putting people on ventilators, blah, 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 blah. So one of my other friends told me that I'm being a little negative on this podcast, or like everything's sort of doom and gloom. Oh yeah, so John mentions hydroxychloroquine preliminary results to come back in 1 week. That'll be really interesting because New York State, beyond having good medical data, unlike China's numbers, which are not really trustworthy, and the rest of the world, has good data. And again, the Solidarity trial is the big international trial, the World Health Organization trial, but at least you got good news about hydroxychloroquine. And again, Remdesivir is not so great, but I'll get into that. So, I've been told I've been too negative on this podcast. Everything's doom and gloom, and I should talk a little bit about the good things that are happening. So I want to mention some positive things. So as you guys all know, and welcome to Linda coming in from Sweden. Oh, I know. Sorry, she's in Maryland, but she's from Sweden. Anyway, so my friends, I'm going to give you a little bit of a good news update today from the world, US, and Hawaii. Not that there's not negative news, but the good news is, again, as you've seen, let's go to China. China is reopening up a little bit, even though, yes, there are people who are retesting positive again. Yes, they're kind of on their second wave, but they are reopening. They're showing some signs of, doing their economy, reopening parts of it. Their tourism is reopened. I don't know that that's necessarily a great thing. And certain other places, again, Singapore, Japan, South Korea. But again, they're all, on the downside, they're sort of hitting some of their second waves. But again, I want to focus on some of the upside. Spain and Italy, again, they've gotten really destroyed. The US is now the epicenter of the pandemic, but Spain and Italy are starting to peak out their curves. Their death rates are slowing down. Spain has 170,000 cases, and Italy has 160,000 cases. We have way more, almost 600,000 cases. But again, like I mentioned last time, you can't just look at total number of cases. Obviously, we're a bigger country than either Spain or Italy. We're as big geographically, look at it on the globe, bigger than all the rest of all of Europe, basically. And welcome to Veronica coming in on Instagram Live. My point is, Spain and Italy, for the first time, their numbers of deaths and active cases, or definitely deaths, I got to check about the cases, has gone down day over day. Now, that's not a trend, but again, you're seeing signs because they are sort of following what happened in China. And again, we can believe the Spain or Italy numbers. I'll get into that because some people are like, can you really believe all the death numbers? Maybe they're testing everyone that's died, and everyone that's died of everything. If they have COVID-19, then they're counting that as a COVID-19 death. Does that really count? So I'll get into that. That's a good point. But again, however, whatever metric you're using, every country, however they're measuring it, their deaths are going down. So again, you got to look country by country, and even within the U.S., state to state. Now, U.S., I'll get to that later. But again, even New York is starting to peak. Even Governor Cuomo if you've seen some of his press briefings, which I know people like watching his press briefings way better than, let's say, Trump's press briefings, which go on for hours and are very political in their way. Even he is admitting that New York is starting to see a turn. We won't need as many as those ventilators. If you looked at some of those charts I pulled up, that looked at ICU usage and bed usage, and how many extra ventilators we're going to need, how many extra hospital beds we're going to need, how many ICU beds we'll need. All the numbers are getting better, and all those peaks are sort of slowly going down. And welcome to Jay coming in on Instagram Live. But before I get into all that also with the world, I want to mention one thing, because everyone, including you guys, and I still want you to ask questions. Everyone's been, number one, asking me a lot of questions of data and studies and new drugs and whatever. And welcome to Myrna coming in from Florida. What I love about this podcast, by the way, it's kind of my therapy. I get to unload a little bit of my angst and give you the only way I can help, my knowledge. And admittedly, I'm not an ID doctor or virologist, but I take care of ICU patients. I've treated people who've died from pneumonia and influenza and everything, and I've managed ventilators. So I think I know more than an average person. Anyway, my point is everyone sends me these studies and these questions, but I want to mention one major link I want you all to bookmark right now, and it's called PubMed. P-U-B, like a bar, like a pub, med. It's publication medicine. It's sort of short. PubMed, not .com, but .gov. So it's an NIH, National Institute of Health site. So I know a lot of people don't trust the government. They don't trust CDC or World Health Organization or anybody or Fauci or whatever. But bookmark this. And the reason why I want you all, every single one of you, everyone on Facebook should be bookmarking pubmed.gov. The reason why, and I added a link on my captions for this podcast, is that it's a Google site. But what kind of site is it? It's instead of you getting false and fake claims and you don't know whether this is a good study, if it's peer reviewed, is it double blinded, is it from what journal did it come from, what drug, are these real doctors, are they fake doctors? PubMed is a Google. It's a Google for all these studies. So if you hear about hydroxychloroquine, if you hear about vitamin C, which some weird people are saying cures COVID-19, and welcome to Amy and Slacker coming in from Instagram Live. So again, pubmed.gov, you can type in this term in Google, and you can type in COVID-19 sunlight, or COVID-19 hydroxychloroquine, or COVID-19 remdesivir, or COVID-19 or whatever, or surgical mask COVID-19. It's a great resource. So use PubMed. And I know what a lot of you are going to say. A lot of you are going to say PubMed is a little technical, and even Marissa says PubMed's great when you're working your doctorate. But the point is, it's an easily searchable database. And once you start to read a few studies, my friend Brandon kind of said, oh, well, anyone can read these studies, so he doesn't really trust doctors more than other people. And, that's a point that's taken. I wouldn't trust a plastic surgeon or a dermatologist to take care of COVID-19 or an ICU or ventilator, because even if they're bright, they haven't really done it. But your average doctor has read studies. We know how to calculate sensitivity. We know how to calculate specificity. We know what double-blinded mean. We know what a placebo means. We know what are the pros and cons of studies. So as you start to read these studies, and hey, Samantha coming in from Instagram Live, as you start to read more and more of these studies on PubMed, not on Google, not on Facebook, not on some bizarre hippy-dippy, Reiki master site, or from a fake doctor on unmentionable, podcasts and TV network experts, you can do your own research. Take the power into your own hand. Don't trust what someone is telling you. You all want to do your own research. Here's how you do the research. Learn how to read some of these studies. Maybe once a week on the Traveling Doctor website on Facebook, I'll post up what I think is a legitimate study link. I haven't been doing that as much. It's very easy to forward something. No one reads the studies. And I really, and welcome to Evie coming in all the way from Germany. I love all this, that everyone's coming in from all over the world to check this out. So again, pubmed.gov, and you can use it if you're not in the US. You can use it in Germany, in China, and it collates data and articles from all over the world. And welcome to Janelle coming in from Florida, and Simon coming in from Denmark. And Simon says, can I call Sean from The Good Doctor? He knows a lot. So again, the problem is, just like you wouldn't trust your friend who has seen a bunch of like Law and Order episodes or Ally McBeal to represent you in a divorce case or environmental, disaster case or corporate law, you wouldn't trust your friend Karen or Felicia from your yoga class who's seen a bunch of Grey's Anatomy or The Good Doctor or House MD to tell you what's right, right? So why are you accepting their articles? Do your own research. Go to pubmed.gov. So that I got that off my chest, and I'm going to be saying this in every single pubcast. Let everyone know about PubMed. It's Google for medical articles. So again, going back to COVID-19, again, the good news is China's getting better, but again, do we believe their numbers? No. And one downside about China is China officially said they refuse to let data come out now about the origins of COVID-19. I know there's been a lot of like conspiracy theories. All the ones I've heard, oh, it was invented in a lab, either in US and then brought to China to punish them, or it was released accidentally or whatever. Again, all the genomic data says that it wasn't man-made, that it started in a bat. Now, again, is it impossible that it maybe got released from somewhere? No, it's not. But I'm saying right now there's zero data that's shown it. And all the data is out there. But again, China has always been accused of not letting their real numbers out, not reading their data out. Again, the data, the origin data is almost 100% going to say it at least started. The first cases were in like, they say middle November, December in China. So of course, what is the origin data going to show? That China is where it started, and China is annoyed about that because it makes them look bad. Again, there's a lot of anti-Asian racist stuff going on. I won't get into that. I've talked about it already. So, and welcome to Yang Yang and TP Cutie Pie coming in from Instagram Live. So again, China is getting better and reopening up. Singapore, Japan, South Korea are all doing really well. But again, the hardest hit countries, and again, I want to go about this not just by numbers. Again, I've always say you got to look at the total cases per 1 million population per capita. So when you go to the worldometers.info/coronavirus, all of you guys I know have been using that site. They've got really good charts, and then you can adjust on the column by total cases per 1 million or total deaths per 1 million. Adjust for that, okay? And again, like the US is the epidemic center, but we're not doing all that bad. A lot of the other countries are doing worse, like again, countries technically like Ireland, France, Belgium, Spain, even Iceland are all doing worse per capita by total number of cases. But again, my point is that the world is overall doing better. And they are hitting their first waves and coming down. And they're hitting their, but unfortunately, some of them are hitting their second waves and coming a little up. I've seen some projections, even by analysts, by Morgan Stanley from biotech analysts that think they can predict when, that the vaccine will be available for healthcare workers by like October, and then for the rest of the country and the world by mid-March, and that the second wave will only hit in October. Again, I think that's a little optimistic, but I want to stick on optimistic stuff. So my point is the world is turning and stuff is starting to reopen up. Certain industries are reopening up. I think that there's going to be a certain amount of travel. Again, don't look at us, right? If you just look at the US and our numbers, you got to look 2 weeks ahead. Who's 2 weeks or more than that? Even 3 months ahead, right? That's China. They're 3 months ahead of us because they started in December and we didn't start till March. So look 3 waves or 3 months ahead. Pretend like you're surfing and you're not looking at that wave that you just took in or that it's too small. You're looking at the back wave. So China is reopening. Or what are they starting to do? They're domestically traveling. Where are they traveling to in China? Because they want to go to the US and Europe and Australia like they've always done. And Chinese tourists are a big part of the population, right? But they can't go there anymore, okay? So where are they going? In China, they're traveling to where? Obviously, Beijing, to go to the Great Wall of China. They're trying to go to Chongqing, China, which is a beautiful city if you've never been there. I've been to China a lot, so I've seen these places. Hainan, what's Hainan? You guys have probably never heard of Hainan Island, but Hainan is like the Hawaii of China. Look it up right now. I've been there. I've surfed in Hainan, China, when it was still being developed. So Hainan is their Hawaii. They can't come to Hawaii. They can't even go to Bali right now. They can't go to Thailand right now. Or more that even if they could come, the government of China would prevent them from coming back. So my point is look ahead. And what's the prediction? My good news prediction is that the US will reopen. The domestic quarantines, like in California, in Hawaii, that's doing really well. The only states that are doing better than us are like West Virginia and Minnesota, I think. So Hawaii is doing really well. We're going to slowly reopen. Now, I'll tell you, a lot of Hawaiians probably won't want that to happen because they don't like homeless people showing up. They're deporting homeless people right away. And they are also, self-quarantining people. They're actually calling people. They've started giving out tickets. In Kauai, they followed of course, a white couple that flew in from Oahu in Virginia, and they warned them to go straight to their hotel. And they saw the car turn away, and then they stopped them again by car, said, you guys got to go to your hotel. And then they went to a supermarket and shopped. I mean, these guys are idiots. They had 2 warnings, basically. And then as it came out of Foodland, they got arrested. So they will have to pay up to $5,000. They probably won't have to pay that. I don't know, maybe, but they'll have to come back to court, or up to a year in jail. Again, they won't get that. But the point is, look at China. China's relaxing all those things. Before, you couldn't even go from Wuhan to Shanghai, or from Beijing to Jiangxi, or to, Guangdong province to Hainan or something. But now China's reopening. So my point is, that's what's going to happen first in the US. We will be able to travel everywhere. I actually think Hawaii is going to do really well because everyone's stir crazy, right? Places like Puerto Rico, Florida, US Virgin Islands, even Guam, and obviously Hawaii. Those are the top 5 places, and probably Vegas, because people want to party, are going to be good because no one can go to Mexico. No one can go to Cancun. No one can go to the Caribbean even. No one can go to Europe, obviously, and no one can go to Asia, right? So where's the US going to start traveling to? The travel restrictions will be lightened. When do I think it's going to happen? Probably by the summer, some of the states will start lessening restrictions. And John mentions a very good, and Tay, my good friend Tay, who's traveled all over the world and in the Navy, is joining in from Instagram Live. So welcome to Tay and to Jake. So John brings up a good point. He says the first wave is meh. Yeah, we weren't really prepared. The second wave is a real story. He is absolutely right. But a lot of people think the second wave won't come till the fall. That's absolute garbage. I'm telling you again, and this is nothing to be scared of. It's good news. The second wave will come earlier. Again, the numbers are starting to creep up again. China's had the first day, I think, of more than 100 cases. They're starting to have cases again by their numbers. Again, I don't trust China numbers farther than I can throw them. But they're, by definition, if cases are starting to rise again, what does that mean? The second wave started again. So what does that mean? China's second wave of cases have started 3 months after their first wave. So when do we, by logic, expect our second wave to hit again? As they lighten up restrictions. So I think our second wave is going to come in June or July, not in October, November, like this BS Morgan Stanley analyst thinks. And again, I can show you that graph later. So John's right. The second wave is a real story. How do we do it? Again, we're going to have to social distance this whole time, but I'll get into that later. I actually think in flu season, which will be September, October onwards, will be our third wave. That's really going to be our third wave. So John, you're right, but you probably thought the second wave may have been in the fall. I don't think so. Our second wave logically will be like China as they reopened up and as everything's opened up. So again, everywhere around the world is doing better that got hit first. The Italies, the Spains, even the New Yorks, and obviously the China and the Singapores, they're all doing better, okay? So again, there are some sad things. Again, like 80 doctors died in Italy. That's very sad. I looked this up, the statistics. No problem, Tay. Thanks. I'm here to update. Again, the Italy doctors that died, it is very sad, but the average age of these doctors was about 65 or 67 years old. You're like, well, that's a pretty old doctor generally. And you're right. There are doctors in Italy that are coming back 70 or 75 years old. These are heroes. They were in retirement. They didn't have to come back. Maybe they're gynecologists. They probably weren't even infection doctors, but they answered the call to serve, which a lot of my military brothers, including Tay and other people, they understand some of this. They sacrifice their lives. But I mean, it's sad, but it's, I won't say expected, but again, if you're 70, 75, you're in that age range where if you get COVID-19, you get sick and you die you're more likely to die, unfortunately. So it is very, very sad, in that way. But again, Italy and Spain are all coming down. There are other Eastern European countries that shut their countries down earlier. Czechia, like Czech Republic. By the way, you're not supposed to call it Czech Republic anymore. You're supposed to call it Czechia. It's a whole thing. Denmark, my friend Simon mentioned, again, they're slowly starting to let some stuff happen, like I think the nursery schools can open up with social distancing. I think Norway and even Germany is slowly opening up some industries. I'm confused about which ones are exactly doing what. But my point is countries are slowly starting to open. So that is a good sign. I will say I talked to a doctor friend of mine, a younger doctor John, that is exactly that link that John put on Facebook Live is exactly the Morgan Stanley analyst thing, I think, about the second wave. I think that's it, but I don't agree with that, and I've told you why, because they have the second wave coming in the fall, and I don't agree with that at all. But if you are interested in the Morgan Stanley Twitter thing, go to my Facebook Live, and John just put up a link to that. But my friend in Sweden, who's a younger doctor, albeit, she gave me the report from the ground. And remember, Sweden tried to do their herd immunity thing. Now, they're not failing, but again, this is why I think you got to do it country by country. No, Veronica, you got me wrong. Okay, Veronica asked, there's no more Czech Republic? No, Veronica, you're not supposed to call it the Czech Republic anymore. You're supposed to call it Czechia. You can Google this again. There's a big, complicated historical reason why, because it's not technically a republic or there's something else, but you're supposed to call it Czechia, not Czech Republic anymore. Anyway, my Swedish friend says they're not doing horribly, but they're actually not doing as good as Norway or Denmark. If you don't believe me, go again, look at per capita number of cases or per capita number of deaths. Sweden isn't doing horrible, but again, Sweden is full of a country like Germany of people who follow the rules. I don't want to be racist about it. There's nothing racist about it, but Americans don't follow the rules. If we were told not to put on masks and do everything, we wouldn't social distance. It's strictly a cultural thing. So certain countries it would work with. Like in New Zealand, it works also very well because they're super spread out and they're geographical. In Hawaii, we've had very strict quarantine rules, and it works for a combination of New Zealand's thing because we get good geography and no one can fly into us without being quarantined and possibly ticketed. And, Hawaii people, we prepare for so many natural disasters. Tsunamis, we go out and buy stuff. For hurricanes, we go out and buy stuff. The only reason we didn't buy stuff for the fake missile warning in North Korea is because it was like only half an hour that we thought we were all going to die. Otherwise, we would have been hoarding stuff too. So Hawaii's really good at that. Certain states like Florida, other stuff, they're not really doing too bad because they prepare for stuff and they know how to shelter in place, and stuff. Again, the states that are doing the most poorly, unfortunately, are the ones in the U.S. that are like, Florida, Louisiana, which admittedly the lieutenant governor admits that he was wrong. The New Orleans mayor tried to cancel Mardi Gras, and the lieutenant governor said no, and he apologized on TV. He was wrong, just as I was wrong. I thought obviously, as some of you remember, in December, January, I was kind of making fun of COVID-19 coronavirus. I was wrong. And I figured that out in February, especially as I got so sick with my own pneumonia. So, there's a lot of blame to go around, but I don't want to talk about the blame. I want to talk about the positive stuff. So again, stuff is opening up. Sweden's doing better. Germany's doing better. Africa has still very low numbers. I heard a really good story out of Brazil. There was a 97-year-old Brazilian grandmother that survived COVID-19. She's 97 years old. I saw a cute video of them lining the hallways in masks and waving this cute 97-year-old Brazilian grandmother out. Which country is doing, and Joe reminds me, and I'm sure my friend Brandon reminded me that I was saying coronavirus is nothing, and I was wrong. I admit it, and doing these podcasts is part of my penance because I know that I can bring stuff to bear right now with it, and I was wrong, and I was not wrong in that it was still flu-like, but it was much more severe, and I was underestimating that we did not have a vaccine. So when everyone says this is just the flu, this is not just the flu. If you think it's the flu and they think it's the flu, trust me, I have an ICU doctor in New York that would be happy to talk to them and tell them how many patients he's taking care of, okay? So Tay has mentioned, Africa has been doing pretty well, and a lot of people have been not, and again, there's certain places in Nigeria and places that are hit really hard by Ebola, for example, that are poorer countries, but they're used to fighting infectious disease. They're used to fighting malaria, dengue fever. There's this Changkawi virus. There's a bunch of other stuff, you know? And even in Asia, they fought a lot of these things a lot better as well. So maybe, you know, the US hasn't had to deal with a massive infectious disease like this since a little bit of a measles outbreak, you know, and back since like polio and smallpox and actually tuberculosis. You know, when we got rid of that, you know, or a lot of these diseases, smallpox, polio, and tuberculosis, we have not really had to worry about this for like 2 generations, you know? So anyway, so my point is some countries are doing well. South America, South America, Australia, New Zealand, Africa, with exceptions, are doing very, very well. So I'm happy. But again, we have to see how, again, they're going into what happens in our summer, in April, May. It's not their summer, it's their winter. They're hitting flu season. So I worry a little bit about that, but I'm hopeful because as I mentioned for many podcasts, I think many people who didn't get the flu vaccine before are going to get the flu vaccine now and be even more protected. And they're even just going to wash their hands more and wear the masks more, and that will help the entire world out. So that's my like uplifting world news on that. I will say there are certain countries that are not doing well. Some of you may have seen Ecuador. Man, again, I can't verify all these videos, but if you want to see some scary stuff, Google Ecuador, Guayaquil, G-U-Y-A, I think it's Q-U-I-L, Guayaquil, Ecuador. I mean, they can't even pick up the bodies fast enough. And that's in the western part of Ecuador, I think near the coast. And it's really sad. They're literally leaving bodies out in coffins in the street to burn or for people to pick up. I mean, it's not Quito, like the capital. And so certain countries are getting slammed hard because they don't have as many ambulances. They don't have as many coroners. They don't, you know, forget about doctors and nurses or whatever. So certain countries are still getting hit hard. And again, if you look at per capita deaths, that's the countries that I would worry about the most. And those are, again, weird countries that are mostly still in Europe. But again, Sweden is up there. Sweden has more per capita deaths out of anyone, more than Denmark, more than Norway, more than Finland. So especially to my Norwegian and Danish friends, by the data, just by the data, Sweden is doing the worst out of all the Scandinavian countries. So that's to be said, okay? So that's enough about, I guess, the, one other last thing I want to talk about is Boris Johnson. This is another uplifting thing. Boris Johnson got out of the ICU, okay? So he got out of the ICU. He survived it. This is a world leader. I actually was 50-50. I was worried he was going to die. He didn't get on a ventilator. So not being on a ventilator is a very, very good thing, okay? If you're not on a ventilator, it's good because why? The data, as I mentioned, and you noticed, you're probably hearing some of the news report this, on the data, it's showing that if you are in the ICU and ventilated, your chance of living, period, are very low. Some of the data shows that 85% of people die on a ventilator, meaning you only have 15% chance of living, less than a coin flip chance of living, like a rock, even less than a rock, paper, scissors chance of winning and living once you're on the ventilator. So that's very, very sad news. But again, Boris Johnson survived this. His country's not doing well. Again, if you look at per capita deaths, UK is really doing pretty bad as a country. They're one of the worst countries in the world per capita deaths, okay? So I worry about the UK a little bit because, again, what did they do? They tried to do the herd immunity. So which countries have you heard about try to do herd immunity? UK and Sweden. They're not doing too well, guys, you know, for numbers. I'm just saying. UK is, besides Spain, Italy, and France, UK is doing the worst. But again, it's hard because UK is in Europe, you know, and they obviously have a lot of cross travel between Italy, France, and UK. Like, it's like a Ryanair $15 flight, you know? So that, again, let me go back to the US. And as I talked about the US, I'll start with New York. And more good news, New York is hitting their peak. And even my friend who works the ICU in New York and takes care of hundreds of COVID-19 cases. Now, again, I go back to work on Wednesday, so I only have 2 more days on my vacation before I have to go back to work. I haven't really taken care of a COVID-19 patient, But I've talked to a lot of my doctor friends, and obviously I will be taking care of COVID-19 patients when I get back. But he's saying in New York, even in his ICU, it starts to go down. So Marissa asked, do you think that as more data comes in that our approach may change as it may be more of a hemolytic virus, decreased ability of RBCs to carry oxygen lean and decrease oxygen saturation? So Marissa, again, this is one of those like theories, and all it is a theory. There is a really awful doctor. A lot of the articles, and again, you gotta go to PubMed and research this. They are starting to research about COVID-19 and hemoglobin. And I've talked about this before. That's why they think hydroxychloroquine work. That's why they think this whole idea about malaria countries that take hydroxychloroquine, or that there's a lot of these articles that say people shouldn't be put on ventilators, and that we got to treat this like a hemoglobin disease. Now, these are all theories. Marissa, I think that's a good theory, but there have been zero tests that have shown that. If that were true, if it was just about RBCs and red blood cells, being able to, not carry oxygen, and we should treat that, we shouldn't be using antibiotics, we shouldn't be using antivirals, we shouldn't be using ventilators, we should just be treating hemoglobin, then you know what? By just theoretical, then we should just be giving people who get sick and can't breathe, we should be giving them packed red blood cells, blood transfusions. We shouldn't even be giving them plasma. We should be treating it and giving everyone hydroxychloroquine. The problem is, Marissa, this is all theoretical. Again, go to PubMed and look at this. You can Google or PubMed, hemoglobin or hemoglobinopathies, and or just hemoglobin. The simpler the word, the better. Or blood transfusion and COVID-19. There are very few studies. There are studies that are being designed to study it, but I agree that's a good theory. All it is a theory. I saw an awful doctor, and by that I mean like a PhD doctor, and not that they're not doctors too, but they're not medical doctors, who was on a show. It was some Indian guy who was an MIT PhD, and he said, we need to treat it like IV, vitamin C, IV vitamin D, and IV vitamin A, and you shouldn't put people on ventilators. This is a guy who hasn't taken care of a single patient, who doesn't even know basic ventilator settings. He's a smart guy. He's a PhD, and he's written stuff and books, but he is really against Anthony Fauci from the National Institute of Health. And, he brings up some good points about the CDC and the World Health Organization. Everyone is behind the times. But again, so long answer to your question, Marissa. Yeah, it's possible. There's zero data that shows it now. But I will watch that. And you should watch that too on PubMed. Keep Googling it. Or not Google, PubMed it. PubMed. Google's not your friend. Facebook's not your friend, except hopefully my podcast and certain other real articles. Look at PubMed. Look at the journal articles from Lancet, New England Journal of Medicine, the Journal of Infectious Diseases. These are the words you want to start listening to. Immunology. There's a magazine like that, a journal like that. These are the articles, the good. If it comes from, Karen's weekly journal of, homeopathic, medicine and crystallology, I probably would not trust that medical journal, and it probably wouldn't be on PubMed. So going back to New York, or the US, I'm sorry. So New York, they're doing better. Unfortunately, still per capita number of deaths and per capita number of cases, New York, New Jersey, Louisiana, Massachusetts, Connecticut, and now Washington, D.C. are doing the worst per capita for cases. And for deaths, it's New York, New Jersey, Louisiana, Connecticut, and Michigan, not DC. But DC is very close. As you heard, people are doing better, and New York's starting to come down. New Jersey's starting to come down. That's very, very good news. We won't need as many ventilators in New York. We won't need to use all of that U.S. Navy Mercy ship or the Jacob Javits Convention Center, or need 30,000 ventilators. Again, what was one of the first things that people heard when you were here? How we know stuff is working is we won't need as much as we thought we did before, and then all the naysayers are going to say, oh, you see, we didn't need it. It didn't happen. That's the problem. They're so short-sighted. They're looking at numbers right now. They didn't look at the data from before. It only is looking that way. That's how it worked. because we didn't need as much stuff in New York and New Jersey. That's positive signs. And again, the states that are doing really well, Hawaii, West Virginia, Minnesota, Guam, and these Nebraska, the geographically isolated states are going down. Are going down already or never got hit hard. Hawaii, I probably won't need to worry about doing emergency shifts for COVID-19 or needing extra ventilators or running out of equipment. That's another good thing. We're not running out of equipment as much anymore. It's short, but I think New York is still shortage. So I'm trying to recommend that people sewing masks and donating protective equipment, they still focus on the hardest hit states, New York, New Jersey. Hey, I'd love to have extra stuff, but we don't need it in Hawaii. New York, New Jersey, Louisiana, the poor neighborhoods. You know what I would actually focus on? Look at the poorest neighborhood in New York or Louisiana, near New Orleans, or like in Detroit, Michigan. Find the hospitals there. You can easily find that on Google, which hospitals are getting hit the hardest, and try to donate the equipment to them because they are going to have a lot of trouble. And what I want to also focus on, a lot of you probably have been getting the initial data. You're right that, this is a disease that is affecting African Americans. And welcome to Daniela coming in. Daniela, I talked a little bit about Ecuador a little bit and South America, but I'm talking about US. And again, unfortunately, the data is showing, and this is a little depressing. The data is showing that African Americans and Hispanics, but more African Americans are getting affected by this more and dying more. And I didn't really know the numbers till I looked at it, but if you look at it, it's striking. There's like 3 times as many deaths in African Americans from COVID-19 compared to white Americans. That's astonishing. By 300%. Blacks are dying from COVID-19 3 times as much. Now, again, obviously you have to tease it out because what are African Americans also having more of? Diabetes, obesity, kidney disease, kidney failure, right? And lower life expectancy. And welcome to Carlene coming in from Florida, Instagram Live. So, obviously blacks are not doing as well in African Americans, and that's why I worry about them. And again, it was hard. There was actually a rumor going around in the black community that black people couldn't get COVID-19. And Idris Elba had to, when he got sick, the candidate for Black James Bond, he was basically telling the African American community, and the NBA players are like, listen, you guys are being ridiculous. Obviously anybody can get COVID-19, but it is kind of sad. LV from Facebook. Hey, LV, I used to work with LV a lot. She asked, will the people being released from isolation be retested? Yes, LV, as far as I understand. Now, here's another interesting thing. COVID-19 is like a lot of the diseases that are serious, like tuberculosis. Actually, like syphilis and gonorrhea and chlamydia and let's say like smallpox or anthrax. If we got cases of these are reportable to the Department of Health. So the Department of Health in each state, because there's different departments of health for 50 different states, they keep track of these cases. So when they're released, they will be tracked again, and they try to do this contact tracing. If you don't know what that means when someone gets tested as being positive, the Department of Health has to try to call these people. As you can imagine, for like New York has almost 200,000 cases in New York's alone, New York State, not New York City, and they've got 10,000 deaths in New York. I mean, that's extraordinary. That's 3 times the amount of people that died in 9/11. And keep in mind, less than a month ago, just more than a month ago, we had 0 deaths in New York. We had 0 deaths, and a month later, we have 10,000 deaths. That's astonishing. That's what they mean by exponential and logarithmic. But my point is, it's hard to contact trace everybody, but they should be retesting the people in isolation for negative tests before they release them from the hospital back into the community. Now, the problem is the states are having different versions of who to test. For example, in California, welcome to Lawrence, my buddy, and Ben coming in from LA. So different states are doing different things because like Hawaii and California are doing much better. So for example, California, Hawaii are recommending that anyone gets tested, that asymptomatic people, in other words, anyone, like even if you don't feel sick, if you have time and there's a free drive-through testing, that you get tested. So anyone, even if you feel healthy, that you don't have a cough or fever, California and Hawaii are saying that. New York is not. Guess what's happening in New York? New York, they're running out of swabs. They may have all the testing stuff, like that 5 to 15-minute fast test. They're running out of swabs. So New York is not telling everyone. Because guess what? There are 15 million people in just New York City. They don't even have 1 million swabs left. So they can't even test all the people in New York City. There's no way. So New York has a shortage. So what do they have to recommend? That not asymptomatic. Only in New York City, they're only testing people in the hospital. Not even if you have a cough or a fever. Not even if your husband or wife or girlfriend or child had COVID-19 and you happen to have a cough or fever. They're not testing you in New York with that. They will in Hawaii and California. So that's my point, right? Everyone is saying, why is it in this part of US and it's not here? Because we're 50 freaking states of America. We're like Italy and Spain and England and Germany and Albania and Montenegro. I'm not going to try to show off all the countries, but my point is there's like however many countries in Europe and there's 50 states in America. That's why 50 states have to do different things, and even cities within the states. Like New York State is going to be different from, Ithaca, New York, in upstate New York. I was just noticing, by the way, you may have seen some of it. As I'm talking, I've been spitting out accidentally. And welcome to Kenneth Belkin, my buddy Kenny, who's a brilliant lawyer in New York. And again, for all you guys, I will save this live story to my Instagram later, and I will be saving this to my Facebook, both on the Traveling Doctor and on YouTube and Twitter afterwards too. So be happy. You're welcome to forward this to any of your friends and family. Have them join in Mondays and Thursdays, 1 p.m. I will not be doing it, by the way, 1 p.m. this Thursday. I'm going to be at work. So I'm going to be doing it late. I'm going to be doing it about 8 p.m. Hawaii Standard Time, which I know is 11 p.m., kind of late for you parents, at least on the West Coast. And all you New York guys, unless you're like night owls, it'll be 2 a.m. So sorry about that. But I will save this so you can watch this later, okay? Where was I? Oh yeah, so my point is, even as I was talking, I was spitting out by accident, and some of my spit hit my phone and my computer. So that, there's another of these articles that's saying that's why states are even recommending different things, right? Like Hawaii, some of our states are recommending wearing masks even when you just go out. Fabric masks, doesn't have to be surgical masks, because again, the World Health Organization and CDC did not recommend these masks for everybody because we're going to run out of surgical masks. So I haven't liked the World Health Organization and CDC because they've always behind the times. They are managing social chaos. If they'd said that the recommendation was everyone in the world has to wear surgical masks when you go out, there would be riots. People would steal literally surgical masks and rob, and they're already robbing. Like I told you, they stole $250,000 of PPE in Hawaii. So my point is, you just need something to cover your spit, right? I got on my mask, a personal mask that I will wear when I go out. It's not a surgical mask. And I will wear a surgical mask in the hospital when I'm not taking care of COVID patients. And if I take care of a COVID-19 patient that's really sick, obviously I'll get my N95 mask and I will have to ration them. So if doctors have to ration them, that's the point. My point is, even if I'm spitting for a podcast, luckily I'm not having dinner with you. Otherwise I might spit in your face and you'd hate me as a friend and you'd be annoyed by that. But, that's a big problem. Greg, so do I think it's good that the US doesn't have a national lockdown policy since the state is different? Greg, not only do I think that's a good idea, it's a constitutional idea. I don't agree with Trump on a lot of things, but he's right. The problem is different states, different governors have different powers. And so they have to do different things, because treating Hawaii like their case is completely different like treating New York. On the good side, Greg, I will say that even if Trump says, hey, we're going to reopen the whole country, let's do everything, guess what? It works the other way. The governors don't have to listen to him. And or they could do their own thing and keep the state closed, and Hawaii could still quarantine people because we have our own Department of Health. We have our own government. We have our own state, whatever. Trump actually and the federal government has zero ability really to say, no, you're not allowed to quarantine anymore. You're not allowed. And even if they did and they fought it in the courts, that would buy us time. Every state can do what we want. So Greg, I absolutely don't think the US should have, I mean, at least at this point where the peaks are coming down in New York and other places, that we need a national policy. But that means each state is only as good as its own governor. And hopefully by now, all governors and senators are treating this seriously. Again, Hawaii, we're brilliant in that we have a prime minister, a lieutenant governor that's an ER doctor and master of public health, Josh Green. Again, for all my Hawaii friends, check out his Facebook page. He hasn't done it over the weekend because it was Easter, and I think he was working in the ER in Big Island. But Lieutenant Governor Josh Green gives great daily updates. So each state should have its own policy based around that. But you have to be aggressive, and you can tell who should be most aggressive. New York, New Jersey, Louisiana, Connecticut, Michigan, and Massachusetts. Those are the ones that are hurting worse. And as all of you seen, some of you probably not even from America have seen Andrew Cuomo, Governor Cuomo of New York, his updates, which are probably more informative and better than Trump's, obviously, besides the Fauci stuff, So generally, we are doing better in the country. And again, the hot spots are still those ones I mentioned. I'm very worried about the Black, African-American, poor population in Detroit, Michigan, New Orleans, but even anywhere, even in New York, even in places that are doing well in, LA, like the poorer neighborhoods, the homeless people. As you notice, people are needing food more. We've been giving out food for free from our food bank. We had someone donated thousands and thousands of dollars worth of free eggs and milk and bread and potatoes. And there was a 3-mile line. I could see it from my condo right outside Ala Moana Mall. They were giving away food and cars are lined up. Even richer families were coming. I mean, it's free food. I mean, why not? I didn't line up, but I have enough supplies, but everyone is hurting right now. And welcome to Mike coming in from LA on Instagram Live. So, countries are doing, states are doing better, but what are we seeing? Like, people haven't had work for a while, so they need food, okay? One other update, I heard that the stimulus checks are finally starting to come in again, and people are getting help with putting off their mortgages, no questions asked. If you ask your bank who you have the mortgage with, for I think minimum of 6 months, if not a year, if I'm right. If because I know, by the way, I even know doctors that are worried about their bills because they're like doing, dermatology or plastic surgery. And again, I don't feel that bad. They've been making millions of dollars, some of them, or hundreds of thousands of dollars, and they have some savings. But again, some people are not working. You can't. You got to look at every family situation differently. So people are getting some of those small business loans, some of that government stimulus stuff. I will say, unfortunately, from what I understand, the House of Representatives is on vacation until May 4th. So another round 4 of government bailout bill probably won't happen until earliest May 4th. That's like almost a month away. A lot can happen in a month. So I'm a little bit worried. From a financial aside, earnings week starts tomorrow. So a lot of the banks and a lot of the, Microsoft and Apple and like different companies are going to be starting to report some of their earnings. And I think it's going to look really bad. You can't give guidance for your company, right? For almost a year, because you don't know when we're going to have the vaccine and when you can fully open up. There's some sad stuff. AMC, what's AMC for all you don't know? It's internationally, it's one of our biggest movie chains. They're in bankruptcy talks. Because no one can go to movies anymore. We've all been doing what? Watching Netflix or Disney Plus or Hulu or YouTube or whatever, right? So no one can go to movies. And for example, the countries that are opening up their movie theaters, like in China, you know what they're doing? They're only opening up every 3rd seat. In other words, you have to sit 6 to 9 feet away, 3 seats away. They can only sell 1 out of every 3 of their seats in the movie theater because they have to comply with social gathering laws, So it's tough. Like, the movie industry is getting hit really hard. And welcome to Daniel coming in from LA. I've been talking to him a bunch, so he knows a lot of my theories already. I've been, saying so far. So anyway, one other thing that I want to mention is that it is, a lot of people have been asking, when's this antibody test coming out? When's this antibody test coming out? So I'm sort of jumping around. Again, Hawaii, we're doing excellent. We are doing really, really excellent. I think one thing you got to look at is, by the way, I forgot to mention this, antibody tests are starting to come out, right? But again, what have I always said? Look 3 weeks or 3 months ahead, okay? And yet Allison mentions the film and community industry has been hit hard. I watched Survivor, which my friend Daniel, who was one of my bigwig actor friends, was on Survivor. He was the first Asian guy in Survivor. So, shout out to Daniel. But again, I was watching Survivor and like Love Island, all these reality shows. What are they all doing? They're all right next to each other and making out with each other, and like film sets. Like, you cannot act. You can't act. You can't film stuff without being 6 feet close to each other. You may have seen, I haven't watched it, it's on my DVR. Saturday Night Live was hosted by Tom Hanks, who had COVID-19, and it was all done remotely. I mean, some stuff you can do that way, but generally it's hard to film, right? So the movie industry is hit really hard. But anyway, going back to my point about antibody tests, when are antibody tests going to be available? Everyone's asking, Albert, do you have an antibody test? I'm like, no, I don't. But guess what? By the way, it may still be in time. You may have heard it here first from the traveling doctor. The NIH has a study, a free study, and it depends whether you trust the NIH and Anthony Fauci and all this stuff, for 10,000 volunteers. They're seeking 10,000 volunteers to mail at home an antibody IgG/IgM test for free to be part of the study. The only qualifications is you cannot have been COVID-19 positive by any other test. And number 2, you have to be asymptomatic, no cough, no fever, whatever. Google that. I can have the link up later, but I've signed up, my parents have signed up, and they will call you and maybe send you an antibody test. You'll be one of the first people in the US to get this test for free and figure out if you're IgG/IgM positive in a 10,000 prospective person study by the NIH. So hopefully you're Googling that right now. Anyway, I got distracted. My point was the antibody test in Asia. Did you know you can go into the pharmacy in Hong Kong and buy an antibody test, like on the shelf from CVS or whatever? If you don't believe me, talk to your friends in Hong Kong and South Korea and China, whatever. But what has happened? Why don't we have these tests in the US? US is denying, they are a strong X, those tests to be shipped to the US. This is PPE all over again. Remember, they didn't allow KN95s and certain nasal pharyngeal tests to be coming in from Germany and other places. They are not allowing some of these antibody tests. They are wanting, because, I mean, there's the reason why it's not just a conspiracy that they want, certain companies to make money. Of course, they want to support US industries, but they don't have quality control. Just like you've heard that there have been fake masks coming out of China. By the way, the masks I ordered, the company still hasn't given them. And I think I got scammed. I'm going to have to contest the charges on my credit card bill. And welcome to Danumba from Instagram coming in. So my point is that, and welcome to Jackie Oahu back again. My point is that we cannot just say, oh, let's go buy all the antibody tests on the shelf from CVS and Walgreens or whatever they are in Hong Kong, and have all your friends send hundreds of thousands and millions of these tests to the US, because we can't vouch for their effectiveness. They were made in Hong Kong and China and other things, and are they real? We haven't been able to see that they've been real. Now again, the CDC is doing emergency authorization for a lot of these antibody tests and a lot of these antibody nasopharyngeal stuff going on. We'll see. What's my best guess? My best guess is the antibody tests will be available or first to the hardest hit ones. So logically, who first? The people in New York who are first responders, the doctors getting sick, the nurses getting sick, the EMTs, the police officers, the fire department. They will get it first. After that, it will be the sick contacts, or the contacts of people who are sick already. Who will not get the antibody tests are any, like the NIH study, no one who's tested positive for COVID-19 will get a test. They don't need a test. We know they have COVID-19 already, and either they recover and get better, or they get sicker and get intubated, or worst case, they die, unfortunately. So the people who have COVID-19 positive already by the nasopharyngeal or oral pharyngeal test, they will not get these antibody tests. And everyone it's again, like I said last time, it will be toilet paper and Costco toilet paper and paper towel and surgical mask hoarding all over again. Everyone in every state, even Hawaii, is going to be super pissed. Why don't I get my antibody test? I want my antibody test. Why can't I go buy this in Walmart? The government screwed up. So, I mean, I'm not going to get into all politics of it, but again, maybe by May or June, you will start to hear about people getting nationwide antibody tests, but only for a specific population. My bet is by the end of the summer, and by early fall, definitely before there's going to be a rush before that second wave is starting to hit again. But again, I think the second wave is even going to hit in June or July. There's going to be a rush to get more and more antibody tested, not just the swabs. They'll still do those swabs because we have that in place already, and we can make more of those test reagents and the nasopharyngeal swab. So, that's what my expectation is. Am I right? Am I wrong? Only time will tell. But that's what's going to happen. And so Jackie asked a really good question. If you've been diagnosed once and recovered, will you always carry those antibodies? Jackie, that's another article that's come out. A lot of articles you have seen, and welcome to Agnieszka from Singapore coming in. So, and welcome to Julie Tiberti coming in. I'm not sure where she's from, possibly Italy. Now, a lot of the articles that have been forwarded to me have said a lot of people who are testing negative for COVID-19 are testing positive again. Now, there's a difference. Were they getting tested positive for antibodies? No. These are the people that had nasopharyngeal viral load, PCR positive, and then they were negative, like Elvie asked. They were negative and they got released from the hospital, and now they're testing positive again. Does that mean they are infective? I don't know. Does that mean they will get sick again? I don't know. Does that mean that they don't have antibodies? I don't know, because all of these tests are just talking about nasal PCR. But to answer Jackie's question, if you have, let's say, an antibody test and it shows you have IgM, IgG, will you always have those antibodies? I don't really know, but my guess is you should have them for at least a while. And what's a while? Maybe a couple months, maybe a year, but it will buy you some time. In other words, that IgM, IgG won't immediately disappear. The PCR, the virus, will disappear. And if you have my guess is if you have a lower or not so good IgM, IgG response, if your body, for whatever reason, your immune system, let's say a chemotherapy patient, right? They have a crappy immune system. They might not make good IgM, IgG, and they could get sick again a lot quicker, I think. Because why? It's like a country where you didn't have enough, auto production, and they were shut down, and now you want to reopen them. Are you going to have as many cars again right away? No, because you don't have as many car factories. So it's the same concept. So to answer you, Jackie, I think generally if you're a healthy person, most people will carry IgM, IgG for a long time, but we don't know how long that is. Oh shoot, I'm getting my Instagram warning live thing. That means I'm on 60 minutes. God, I always try to keep this below 60 minutes, but there's a longer one of my last ones. So all my Instagram live people, I'm gonna restart it immediately, and then you can rejoin me again at that time. Because again, I'm limited by 60 minutes for Instagram live stories. And all my Facebook live people, don't worry, it won't shut off. So that's about the antibody testing. Now, I want to talk a little bit, and I don't want to spend all my time talking about hydroxychloroquine, all these different medicines. So that's about the antibody tests. I talked a little bit about masks, and again, you could donate masks and different things to mask-match.com or to your direct hospital. Again, focus on the poorest hospitals in your poorest neighborhoods if you want to feel like you're doing a good thing. And again, a lot of people are reusing masks. So I want to talk about, so Jackie's question, which I'll answer right after the read break, is Jackie of Oahu asked, do you think, and please guys, ask all your questions right now. Jackie of Oahu asks, do you think this virus will be recurrent each year? I'm wondering if the flu season will turn into COVID season. Jackie, no, because COVID-19 will eventually have a vaccine. So by definition, it will be COVID-20 next year. There may be a COVID-20. Will it be as bad as COVID-19? I don't know again. But I think our flu season will be the worst time for us because we will have to battle influenza. Influenza does match the hot and cold seasons. It's not as common, the flu season, any time it's hot. That's why in Australia, you don't get your flu vaccine until now in April and May when their winter is coming up. But in America, we get our flu vaccine when? In September, October, when our flu season is coming up. Okay, everyone at Instagram Live, I'm going to restart this right now, okay? So see you in a second. And everyone else that is, again, in my Facebook, just hold on one second while I restart my Instagram Live. So, okay, I'm back on Instagram Live. Welcome to everyone joining back in. So again, and everyone on Facebook, please go ahead and ask your questions there. A lot of people but talking about the I think the flu season is going to coincide with one of our waves, and welcome to Jake again. So I think our COVID season will, COVID-19 third wave probably, that's my best bet. Our third wave for COVID-19 will coincide with our flu season this year. And welcome to Timmy Martini coming in on Instagram Live. I expect that the flu seasons will be less, that our pneumonia, but again, this is another plus side. Pneumonia, rates of pneumonia, rates of flu, rates of any upper respiratory infection will be lower because we're all wearing our mask and washing our hands. Again, even for a while, this changes our behavior. I believe everyone will be traveling with masks in airplanes and like tight trains and whatever. I believe everyone, so those things will lead to a lot. And welcome back to Jackie of Oahu. So I believe that a lot of pneumonia rates will go down. A lot of our flu rates every year will go down. And I've said this again, I'm not just like playing Monday morning quarterback or saying it now because everyone said this. If you look back at my podcast from the very beginning, from a month ago, my first podcast was like March 13th. So this is almost like the 1 month anniversary of my podcast. I've been saying from the very beginning, I think a good side of this is all our hand washing, all the hand sanitizing, all our mask stuff, all of our not shaking anyone's hands anymore, all of our being better about this, all of our getting better flu vaccines and taking more flu vaccines is going to lead to lower rates every year of flu, of pneumonia, of upper respiratory tract infection. And a good side, people will stop smoking. I've had friends who are like, oh, well, maybe should I do marijuana and do whatever? I'm like, hey, you know what? If you want to do that, again, I'm not giving you official medical advice, but I would rather do a CBD oil or take an edible than smoke a joint. Everyone's like, oh, well, marijuana's safe. It's just that, whatever. My point is this again. Do you want to put yourself through a risk, any sort of strain on your lungs at all, even if it helps you for your anxiety or your pain or whatever? Would you want to put your lungs at risk right now when what does COVID-19 do? It stresses the lungs. Now, I've seen a lot of other, before I go into other drugs, about theories. The biggest theory I addressed a little before that, this is a new disease. This is about hemoglobinopathies and red blood cells. And forget about the 5G stuff and the ridiculous stuff, and that we have to treat with IV vitamin C, IV vitamin D, IV vitamin A. And Jackie, specifically, I'm talking to you, Jackie, and anyone out there, you have to go to pubmed.gov. I'm restating this. PUB, like bar, pub, med, like short for medicine, pubmed.gov. That's like a Google. So for all medical journals. So if you have a question about this, go to PubMed and look for the articles that show that. And then learn how to read these articles. So you're like, I heard vitamin C helps kill COVID or helps kill upper respiratory tract infections. There, by the way, I looked at an article, really interesting article that looked at Tamiflu, that looked at zinc, that looked at vitamin C, vitamin D, vitamin A, and what did this meta-analysis, what does that mean? They looked at a whole bunch of different studies, the data, and what it said about upper respiratory tract viral infections. Do they work? Do you know what this article said? It was a big meta-analysis, and it said vitamin A, vitamin C, vitamin D has no statistically significant showing of it being helpful for viral. So all these doctors, these so-called doctors and articles that say that it shows it, it doesn't show it. Show me the article that shows it. Show me the data. It doesn't show it. It shows that Tamiflu helps with viral infections and influenza. And it does show, well, half the studies show that taking zinc, for example, zinc gluconate or zinc acetate, those are the two different forms of zinc. Most of the forms of zinc that people take are zinc gluconate, zinc sulfate, and zinc acetate. But the one that you're used to seeing, but you can't find on the shelves anymore, is Coldi's or zinc gluconate. Now, I believe in it. Is that official medical recommendation? Again, half the studies show that if you take zinc gluconate early, like the first 24 to 48 hours of your symptoms, it can help you fight off an infection. And it's annoying because it's like a lozenge, and it's like a Halls. You have to take it every 3 hours, and it messes up your taste. Oh, by the way, another little update. And welcome to Amy coming in from Las Vegas from Facebook Live. For my update with my friend, I have one good friend, COVID-19 positive. And unfortunately, I also have a friend, her uncle died of COVID-19. So it's been really sad. But my friend with the smell, he lost his smell. He's COVID-19 positive. He didn't have to go to the hospital. He's doing much better. But I haven't found out whether he got his smell back. I heard a lot of these people lose their smell for weeks. Oh, Greg asked, will COVID's leftover lung damage increase the chance of asthma or pneumonia later in the person's life? Greg, that's the theory, yeah, because if you look at the x-rays and CT scans, now again, China and a lot of countries are recommending, oh, you need to do CT scan for everyone because that could show that you have lung damage even when, and welcome back to Daniel coming in from LA, that CT scans will show lung stuff before an x-ray because again, a CT scan is way better than an x-ray. But again, a lot of especially the people, Greg, that have been intubated, that have pneumonia, ARDS. ARDS stands for acute respiratory distress syndrome. A lot of these people show signs of inflammation and pneumonia at the very least. And so, Greg, from what I've seen from treating a lot of people with lung disease, with chronic obstructive pulmonary disease, and lung cancer and lung stuff. This is my long answer saying yes. I do think that it will increase your ability to get asthma or pneumonia or any flu or any ARDS again later because you're working with weaker lungs, weaker lung capacity. It's like you can think of your lungs as balloons that get, instead of normal balloons, blow out, and think of an old balloon. That rubber gets really bad. It's very constrictive, right? It doesn't expand as much. You can't expand those lungs to get as much oxygen as much. That's what I would say. So I would say yes. Agnieszka, I see Jackie's got a question, but Agnieszka from Singapore asks, what will happen if new versions of COVID, like COVID-20, come faster than new vaccines? Agnieszka, again, the problem is it's a designation. Like COVID-20 will be called COVID-20 if it hits. They may even call COVID-20 COVID-20 for our flu season because it will go again until 2020, into January, February. So they may call it COVID-20. They may start calling it COVID-20 by the fall because it may be a new one. And the 19, the 20, these are designations about what a virus is. So what will happen if new version of COVID come faster than vaccine? Agnieszka, my optimistic side says we've been studying coronavirus now very hard for a couple of months since it hit China. So my hope would be that the vaccine for COVID-20 will come a lot quicker than this. It takes a year to take for the COVID-19 vaccine. So my hope is that as soon as they get a first case that's starting to spread more, I don't know if it'll spread in China or spread in Italy or spread in Iran or somewhere else. My guess is it will spread in an earlier country that slips up more, that doesn't have as many resources. So something like an Iran or Italy or a Southeast Asian country like Thailand or Philippines or something that is maybe has poorer populations and or worse. That maybe they'll study those cases and start making the vaccine right away. So Jackie of Oahu asked, do you think the delay on approval for hydroxychloroquine is due to side effects Isn't recovering from COVID a greater benefit than some temporary side effects? Jackie, so to answer you, the problem is it's not the approval. They've approved it as emergent use for hospitalized patients, for moderate to intensely sick ICU patients. So the delay on approval for the let's say the normal person, let's say someone that's not as sick, doesn't have oxygen, doesn't need to go to hospital, but feels pretty run down and are COVID positive. The reason why the approval is delayed is we don't have supply. Ask me one pharmacy, call your pharmacy, do this right now, literally call your pharmacy, ask them if they have hydroxychloroquine, just ask them, call a pharmacy. They don't have it. So they can't make the recommendation if they don't have the supply, right? The CDC can't make that recommendation if everyone that is testing positive for COVID-19, and again, how many people are testing positive for COVID-19? In the US, there are 500,000 cases. In other words, and you know how many doses you need? You need how many? 2 pills a day times 5 pills and a 6 day. So you need 12 pills. So essentially, just say 10 pills, okay? You need 5 million pills available in the US just to treat all these people. You don't have that. So they can't make that recommendation, Jackie. And yes, Jackie, you will need a new vaccine for each COVID breakout. Or for each year's breakout. Because again, at some point, coronavirus will change and it will be something different, or they'll see a different outbreak and they'll have to study, did this come from the original COVID? If the genetic changed too much, and especially if it's 2020 already, they will call it COVID-20. Now, I don't think that's necessarily absolutely going to happen. I think once our vaccine for COVID-19 hits, it will ideally take care of a lot of these strains. I really do. Maybe the next virus will be paramyxovirus. Again, if you look at the Contagion movie, it was a paramyxovirus. It wasn't coronavirus. Will the vaccine each year be a guess? No. Jackie, they're going to have a flu vaccine every year. And then they're going to have a COVID vaccine that they're going to have to develop based on what they're seeing is going to come up. So I really don't know whether we're going to take a COVID vaccine every year. And to answer John asked whether there will be a universal vaccine every year for COVID-19, like there's a universal flu vaccine that they try to get out. And I don't know about that yet. Obviously, they'll do it for the flu, but for COVID, it depends on the outbreaks, right? It depends on which flu the World Health Organization is starting to see. And the World Health Organization, like you all know, they messed up. They've got a lot to prove to me that they know what's going on. And as you know, sometimes you get the wrong vaccine for even the flu. So they treat it so say, for example, they look at COVID-19, let's say it version 3, and then there's like an A type and a B type. And one is more popular in China and one's more popular in Italy. It's starting to bump up again. They may make that vaccine more for the COVID-20, right? To prevent COVID-20. So do I think there'll be a universal vaccine? John, I'm not in the World Health Organization, CDC, so I don't know. And again, the flu vaccines will differ per country even, So it's really, really tough for me to say. Jackie, to answer your question, I download these all or upload them on YouTube all the time. Just search for The Traveling Doctor and search, or go to Facebook and search for The Traveling Doctor. The good thing about that, and they're saved to my story, but obviously my story disappears after 24 hours. The problem is that if you see this on YouTube, you won't see all the questions that everyone has asked on Instagram Live or on Facebook Live. So if you want to see the questions that everyone has asked on Facebook Live or Instagram Live, I repeat them, but you need to go to Instagram Live or Facebook Live. So just search for The Traveling Doctor if you want that. So that's and answer, Jackie, your question again about hydroxychloroquine. The problem with that, Jackie, oh yeah, I'm sorry, I'm broadcasting as a traveling bachelor, but that's because I have more of my fans on Facebook and on Instagram. But I will upload it to YouTube, The Traveling Doctor, and Facebook, The Traveling Doctor. So just search for Traveling Doctor if you want to see the permanent record of all of these podcasts, the full thing on it, and I will save it there. John mentions also subacute senior facilities. John, I'm not sure what you mean by that. Do you mean, I think you're asking whether there will be subacute facilities where people with COVID-19 are treated to remove them from the population? That's a good idea. That's actually a good public health idea. Again, I don't think it'll be the convention center or Jacob Javits Convention Center or Honolulu Convention Center or anything else, but I do think it will be something. That's a very, very good idea. So answering, because I want to talk a little bit last about the drugs. And again, Jackie mentioned the drugs, hydroxychloroquine, and why can't we just give this to everybody, right? That's, you know, wanting it. Because, yeah, you're right. Generally, the eye side effects and the, so John asks, hydroxychloroquine is okay in subacute facilities. Yeah. So that's good. Yeah, that's good. But again, John, the subacute facilities, are they saying that hydroxychloroquine is good for the COVID negative patients, just to give it prophylactically, or for the COVID positive patients? I'm not clear by what you mean by that. I don't know if they've changed the law. And again, this is what I mean by every state's going to have to change their way that they do that, you know? And so Jake asks, in the Contagion movie, modeled on the Nipah virus, which is the Heniparis virus, or part of the paramyxovirus. Yeah. So again, you know, my point is there's a lot of things that can cause an upper respiratory tract infection. Paramyxovirus, rhinovirus, coronavirus, obviously, influenza virus. When you look at our viral panel, RSV, that's another one, respiratory syncytial virus. RSVs for short. So there's a lot of these things that could cause the next COVID. I don't even know if in 2020, the next one will be a COVID virus. I don't even know that COVID will come back in 2020. That'll be separate from COVID-19 virus. You know, again, that's the one that we need to treat with a vaccine. So, John from New York says Governor Cuomo original banned prescriptions outside hospital. John, I'm glad he did. And again, part of this, John, was a public health thing. We didn't have enough hydroxychloroquine pills. We literally didn't have enough pills. If you don't ban it, in other words, make it legal or available for COVID-19 to be treated, then what happens? If a nursing facility doesn't have that, or a hospital doesn't have that for a patient, they could be sued, right? They could be not participating with the law. And then there'd be lawsuits all over the place. That's why you cannot say everyone who just tests COVID positive should take hydroxychloroquine, Jackie, because of that. So, Jackie also asked, I think everything will shut down again in the future when COVID-20 comes? Or will this virus become a norm like the flu? No, Jackie, but again, you know, I wish we had done, in retrospect, right? We should, when a flu season started, told everyone, hey, everyone, wear your masks again and stay 6 feet, you know, or at least try to stay 6 feet apart from people, or sell, you know, only 1/3 of the seats in movie theaters. So, I mean, Jackie, and to everyone out there, I don't think we need to shut stuff down again when the second wave happens. And China hasn't done that. And, you know, Italy's not going to do that. They're going to reopen stuff. So my point is that when the second wave hits, which I think will happen in June for the US, or June or July, and when the third wave hits, which I think will happen in September, October for us, and when that last fourth wave hits, I think in January or something, before all of US has a good vaccine for COVID-19, we won't have to shut down the economy. We won't have to sit in our awful, for some of us, apartments and deal with our awful, for some of us, wives and husbands and kids, you know, and not be able to do anything just because of that. What we will have to do is, as soon as we see that bump, because at some point, our first peak will peak and really go down. So once it starts to go down, once we start to see stuff start to come up again, at that point, we won't have to shut everything down, but we'll have to tell people, okay, everyone wear masks. And guess what? Everyone will wear masks. Marissa asks a great question. How do I think the distancing will work in schools when limited by class size? Marissa, I bet you they're thinking about it right now. There's going to be a lot more remote working. So a lot of parents, I'm warning you, you're going to have to worry about how they do that. But look again, at Denmark. Look at Norway. What are they doing? They're reopening their kindergartens and smaller schools and figuring out how to social distance. Yes, Marissa, classroom sizes are going to have to be smaller, and they'll probably give an option for parents that don't feel comfortable to keep their kids at home more and have a stay-at-home learning plan. They're going to have to hire more teachers, you know? And again, who's going to suffer? Who always suffers? The poor, the minority, the Black communities, and the other ones that have school districts where it's like 40 kids to a teacher or whatever the maximum is allowed by law. They're going to suffer the most because they won't be able to do that much, you know? They won't be able to do remote distance learning so much. I think all the universities are going to suffer. They're not going to have all their income come in from, you know, over exorbitant tuitions. The Stanfords, the Harvards, the Cornells, the Yales, they're all going to learn. Everyone will want to be paranoid or still paranoid and won't want to be in crowded auditoriums. I don't know, like some of my pre-med classes had 300 people. 300 people for a pre-med class where I was like this. Very good point. No one's going to want to go to those classes. That's all going to be remote learning from your dorm room. At the very least, some people won't even want to go to their dorm. They'd rather save the tuition money for the dorm or the meal plans and stay at home. You know, maybe not Stanford or some of the other schools where people are a little richer or have scholarships, but some of the other ones will want to stay home. So I think distance learning is going to do all that. And again, John's right. Taxpayer money is going to come down. It's going to be pretty poor. John, I talked about this. Earnings season is coming in right now. It's going to be a crap show, man. It's going to be really bad. No one's going to be able to give guidance all the way through Q4 because no one, and you have biotech people again, you know. And yeah, Greg, you're right. Older teachers won't be so happy. Like the older doctors are not happy because we have to do telemedicine. Again, oh, I forgot to mention again, I'm going to end this pretty soon, but I've been telemedicine approved and finished almost my training. So I'm within one day, I'm going to be able to see patients. Again, go to thetravelingdoctor.com. You're going to be able to sign up for appointments or at least send me a message. I'm going to be licensed in the state of Wisconsin, Indiana, Iowa, New York, Delaware, Hawaii. I'm going to be licensed in like 8 states. So if you have friends or family, I can help them out with their medical problems. They don't need an insurance plan. It is insured, but there's other ways you can pay by cash and everything else. And it's for sick notes. It's for COVID advice. It's for just having a urinary tract infection or refill of prescriptions or stuff like that. So that's what I'm looking forward to. Jackie asked, sadly, I do believe this virus has been a good lesson for our country. I think the sick season is bad because workplaces have harsh punishments for workers who miss days due to illness. Jackie, that's a brilliant, brilliant observation. You're right. It's unfair in New York, and it's unfair in yeah. So I'm reading all the questions. Marissa, can I get licensed in Connecticut? No, Marissa, not yet, because I'm licensed in everywhere. These are states that have a lot of problems, so they're giving emergency authorization. I may not be licensed there for super long, maybe only through a couple of months, to be honest, okay? And so Jackie, yeah, you're right. It is a good lesson for all of us. Like, we should have been taking care of our older people. We should not have been hugging all our, as much as I want to hug my parents and my grandparents, or, you want to hug your grandparents, have your kids hug their grandparents or your parents. We should be washing our hands. We should be taking care of stuff. Work should be giving us sick days by law, right? As an excuse, because it's not healthy, especially for COVID. So I think this is a good lesson for society and economy. About this sort of stuff, and workers' rights, right? That we get sick days. By the way, again, doctors don't get sick days or paid sick days, at least, or pause sick days. So Derek asks, John asks, Albert, anything we can do to help? John, thanks a lot. And ask Amy, thanks. This is I'm doing pretty well. This is sort of my, again, my therapy a little bit, and I do it Mondays and Thursdays again. What I think you can do to help is look up your local poorest neighborhood hospital. You all know the poorest neighborhoods in your area, and call that hospital and see what they need. If they need a donation for PPE, if they need donation for meals, for their healthcare workers, or even something as simple as giving blood. Not that it's super, again, giving blood, you're going to have to go in and donate, and maybe you don't want to do that. So I'm not saying don't do that if you don't want to be exposed to needles and people out there, but they do need blood because blood donations are down. Derek asked, do you think it's more unrealistic of us to just boon our immune systems and rely? Derek, I mentioned this. This is why everyone wants to believe in an easy solution. How do you boost your immune system? There are fake doctors out there that are saying IV vitamin A, IV vitamin C, IV vitamin D. Now, I don't think it's a bad idea to take an extra vitamin C and a multivitamin tablet, whatever. But do I think that's going to let you cure yourself of COVID-19 or do better? No, again, go to pubmed.gov and look up vitamin C upper respiratory tract infection, or vitamin C viral infections, or vitamin D or multivitamin viral infections. All the data doesn't show that. So I don't think it's going to work better than hydroxychloroquine. Now, I don't even think hydroxychloroquine will definitely work. Like John said, the data will come out from the New York study soon, so we'll know very quick. Lauren, New York, what platform will be using, Epic or Allscripts? Lauren, I'm licensed through Amwell, American Well, a private doctor-owned thing. So they have their own group. And I'm also technically, once I do it, it'll be through Teladoc. So they cover a lot of different companies. I think they cover Anthem Healthcare and some Blue Cross Blue Shield, a bunch of other stuff. So it depends. I'm not doing Epic or Allscripts. I'm doing Amwell and Teladoc. That's what I'll do. John, Langon is, yeah, so John, I would call Bellevue. I would call Bellevue or the VA or whatever is up in the Bronx, or Montefiore or Jacoby up in the Bronx. That's who I would call, John. Jackie is also saying, and this will be maybe one of the last few questions. Lauren, when I go live, it will be on my webpage, the travelingdoctor.com. I can send you info about it. I'll let everyone know once I figure out how Amwell works and how American Well works. You'll be able to schedule an actual appointment time with me, for that, And if I get a lot of interest, then maybe I'll renew my license for certain states. But again, it costs me hundreds of dollars and other stuff to get my license continued in each state. It's not cheap for me. So I'll see. It'll depend whether I like telemedicine and in Hawaii, how it goes. So let me see. Jackie says, do I think the virus will linger? I think this will be one of the last questions I take because I'm getting on 90 minutes. I need to eat lunch and do some other stuff. Jackie says, do I think the virus will linger or do you think it will disappear soon? Jackie, the virus is going to be here for a couple waves. I know that because I'm looking at China and South Korea. The waves are coming already. So if you want me to put a hard number on it, Jackie, I think this virus is going to linger until everyone can get a vaccine. It's going to linger until March of 2020, if you're talking about COVID-19. And it will be way smaller bumps, but it will be good, So Lauren, yeah. So I'm thinking, yeah, but again, Lauren, this is not my field. I'm an inpatient doctor. I take care of very sick patients who are dying, on ventilators in the ICU and whatever. So I'm not as used to urgent care, and I'm not as used to that sort of environment. But I like the idea of working from home and on my off days, and more importantly, helping people who are in need. So some of my other nurse practitioner friends are also saying that you are right, that telemedicine. They've been doing telemedicine. It's not bad. So I'm excited to get into that. So with that, I think I'm going to end. Again, there has been a lot of other data on Kalicha or Remdesivir, on Actemra, on Favipiravir, and a whole bunch of other stuff. My doctor friends are saying they are really sick. They are using a lot of stuff. They are using like Remdesivir first. And then when they're getting really sick and intubated in the ICU, they are using like heparin or anticoagulation, because there's an idea that it's about thrombosis. And that there's a lot of like anecdotal evidence that Actemra is doing better. The initial Remdesivir, I looked at that study from Gilead. It doesn't look that good, guys. They're going to say that the data looks good, but they didn't even have a control arm in that study for Remdesivir. That's an awful study as far as I know. If you don't have a control arm and that, Remdesivir is not really good. I'll be honest, I'm shorting or Gilead, or I have a puts. I've gotten a bull call or a bear call spread on Gilead because I don't think remdesivir is going to be very well. So only John probably knows what that means. So that's it. Lauren, yeah, I sort of miss the patients too. And again, I get to go into the hospitals to see the patients live. So, I'll be protected, but, I am sort of looking forward to go back to work if I'm going to be totally honest. So with that, I'm going to end. I will try to do this on Thursday, which will be my second day back at work, but it will be a very late broadcast at 8 p.m. Hawaii Standard Time, 11 p.m. California Pacific Standard, and 2 a.m., which I know is too late for most of you New Yorkers, but it will be saved on www.thetravelingdr.com, and it will be saved on YouTube and saved on Facebook. So thank all you guys for checking in, helping me unload a little bit. Please, if you're welcome to private message me. I can't treat people on Facebook or Instagram or whatever, but I can give general information, whatever. And again, I will do the telemedicine thing soon. So stay safe. Happy belated Easter to all you guys. Again, wash your hands, wear at least your fabric mask when you get out, do the 6 feet away. And we are going to get through this. It's not just we're in it together. People are doing it. We're doing it already. Like, we are succeeding already. So I really want to be more uplifting. And I hope I've been a little less negative today. And thank all you guys. Give air hugs and air even fist bumps at this point to all your loved ones from me. And stay safe out there, okay? So again, this is Dr. Albert Lin, the traveling doctor, signing off and saying aloha, okay? Aloha, guys.